outside the patient room, first and foremost is I clean my hands before patient contact. So dispense it off and palm to palm, back of the fingers, back of the hands, interdigital spaces, the tip of the fingers, inner aspect of the hand, the thumb, finally the wrist. It will take about 20 seconds. After that one, you're putting on the long sleeve gown. So pull off the long sleeve gown and pull it over your head. And these finger loops will allow to wear our PPE properly on the thumbs. This must be tied at the back, not at your front, whatever is the size of the long sleeve gowns you are wearing. And this, for the sole reason is that you will not contaminate your hands as you remove it. So tie it at the back, and you can see that one, it is fully covered. The next is to put on the high filtration mask. Again, it's not a piece of item that can be worn easily, but if you put your fingers and the index finger like this, and over the index finger and the thumb, and just over the hands like this, as you can see there, the thumbs and the index finger, lift it over your head like that, and one strap goes literally at the back, over the neck, and pull it over the other strap over the forehead. So you can see there's an angling over the ear and under the ear. Pull the face mask down over the sides, 2 fingers, mold it over the nose, and then you are going to fit check it. That is, it is properly fitted, there's a proper seal around, which is by breathing in forcefully and breathing out. This shows that one, you have a proper seal around, there is no seepage of air. And after this one, either you use a goggle or use a visor, apply it over your forehead. This is to protect your eyes. And finally, put on the appropriate size gloves, either small, medium or large. As you put on the gloves, hold on to the finger loop and bring it over your sleeve that's fully covered, and the other hand as well. So this all happens literally outside the patient room. Now you enter the patient room, you perform care for the patient. As you finish, step away from the patient, close to the door, and remove the gloves. Just hold it with 2 fingers, literally reverse it out. In that process, what happens is that when your contamination is reversed, it is inside out. And the opposite gloves as well. You can hold it, or you want to dispose it of the bin is near enough, that's fine, but you can still hold it to remove your gown. Again, as you are coming in contact with the patient, your ventral part or the front of this one is contaminated, touch the patient or the patient's surface. So you should not avoid contacting here at all. Just break the straps at the back and cross the hands like this to hold the gown over the top, over the neck. Just pull and tear it and just reverse it as you pull it out. You are not contaminating your hands at all, just contacting at the back of the gown. Just roll it and pin it. All within the room, clean your hands again. Once you have cleaned the hands, outside the patient room, you are going to remove the visor. Again, do not touch the front of this one because there could be droplets. Lift it up. Again, single-use item, disposed of into the bin. And finally, the mask. The mask can be removed either using a single finger after cleaning your hands, holding the straps at the back and lifting. But mind, without cleaning the hands, you are contaminating your own skin there. So make sure your hands are meticulously clean. Another simple technique to remove it is, with your dominant hand, just lift the mask at this point, hold on to the straps where it is inserted, not at the back, and just snap it. Just pull it down. That's a simple way of removal. But the most significant part of this one is, do not touch the filter surface at all. If you touch the filter surface trying to pull it out, this is the most riskiest point that you will be inhaling viral particles, because the filter surface is full of fluff, viral particles, dust, which is viral, again, pathogens. As you pull it on, you are bringing your hands very close to the nose and dislodging the fluff and inhaling the particles. This so happened in 2003 in Singapore. Many healthcare workers contracted SARS and they died. pure technique of removal. Again, dispose it off without touching the filter surface, clean the hands. This is a simple way of putting on the PPE and to take it off safely as well. This should offer you a very good level of protection and confidence as well that we can look after the patients should we have a patient with COVID-19 or flu cases, because they spread exactly the very same way.